Hi, how are you doing today?
I'm good. How are you?
I'm doing well, thank you. My name is Isaiah Wallace, and I'm a licensed clinical social worker here at the clinic, and I will be assisting you today. May I ask you what your name is?
My name is Margaret Ellen, and I think my video chat's kind of delayed.
Yes. That is okay. We'll try to do our best to work around that. Sound good?
All right, yeah.
Okay, so hello, Margaret. I just want to let you know that I'm going to take a couple quick notes as we go through the session. It just helps me keep track of our conversation so that I can better assist you in the future. Is that okay?
That's fine.
Great. Tell me, have you ever been to this clinic before, or have you ever seen any social workers before?
No, I've never been to the clinic, and I've never worked with a social worker.
Okay, sounds good. Okay, so for today, we are just going to be talking about any concerns that you may have, and we will do our best to work together to walk through those concerns and then plan any steps that we need to tackle those concerns. Sound good?
That sounds good.
Okay, so before we begin, I just want to briefly mention our confidentiality law. I want you to be comfortable during our sessions, but I need you to understand that all of our sessions will be confidential, and the information that is shared between you and I will not be shared with anybody else unless I have your consent. However, there are a few exceptions. If you disclose that you are going to self-harm or you might be harming others, I will have to notify somebody else just so that we can take the proper precautions in protecting you and others around you. Does that sound okay?
That's fine.
Okay, so what brings you here today?
Well, it seems like over the last month or so, I've been dealing with like a lot of stress and anxiety in regards to dealing with my mom and my brother.
And is your mother and your brother currently living with you, or what's going on with there?
No, they live in a different state. I live in North Carolina, and they live together in Oklahoma.
Okay, so what is it that's causing you this stress and anxiety?
Well, my mom is a former drug addict. My brother has been out of prison now for about 5 or 6 months, and he's living with my mom. He is back on drugs and is having a lot of, I guess, like you say, paranoia, schizophrenic type behaviors, manic, and then depressed, and using drugs, which is causing a lot of stress on my mom. So now they're both calling me about issues that they have, wanting me to take sides. And so I get a lot of anxiety even when I see their numbers come up. And I'm also worried about my mom relapsing.
Okay, so I understand. That must be pretty difficult, but I think you're taking the proper steps in reaching out and seeking therapy so that you can better your situation and your well-being. So let me just get this correct. Your main concerns right now are your stress and anxiety dealing with your mother and your brother's relationship within their environment, but also you're struggling with how you navigate those relationships, being away from them, but also not being too involved with them because they are causing you stress and anxiety.
Yes, that's correct.
So let me just ask you real quick, Margaret, what are you hoping to get out of your therapy sessions?
I guess what I'm probably looking for is how to, I guess, safely, without offending anyone, being able to set boundaries with the two of them. I'm kind of at the stage where I want to not deal with my brother because he's a grown man. I think he needs to figure out what he needs to do, and I can't help him. So, but I also want to be able to maintain a relationship with my mom and have a relationship with her that doesn't have to include him all of the time. So I guess a good way to set boundaries and not carry that burden on me, because it affects me like when I sleep and interact with my family that's here with me and things like that. So I guess how to figure out how to set boundaries.
Okay, Miss Ellen, I think that is a great goal in wanting to set boundaries with your mother and your brother. And in doing so, we will alleviate some of that stress and anxiety that you have. So moving forward in the next few sessions, we'll be working on how to cope with your stress and anxiety or giving you some proper techniques and skills to reduce that stress and anxiety. And then furthermore, we will work with recognizing and understanding those triggers when you are in those situations with your mother and your brother, and how to de-escalate those situations and kind of find you a safe space and how to deal with the stress and anxiety within that moment and when it's appropriate to set those boundaries. Well, Miss Ellen, you seem to be very in tune with your emotional needs, which is wonderful, and you have a great sense of awareness, which will be very important in moving forward in your process of alleviating some of that stress and anxiety. And I think, Miss Ellen, in alleviating some of that stress and anxiety that you've been talking about, and by setting those boundaries, you'll notice that you'll be able to sleep better and you'll be able to maintain, in the long run, better relationships with your mother and your brother. Okay, so moving forward, I would like to see you every 2 weeks. We'll work based off what's best for your schedule.
Wallace?
Sorry?
Miss Wallace?
Yes.
Miss Wallace? I couldn't hear you. After you said moving forward, you broke up.
Okay, I apologize. What I was saying is moving forward, can you hear me?
I can hear you.
Okay, I would like to see you once every 2 weeks. Is there a certain day or time that's good for you? Miss Ellen?
Say that again, Miss Wallace. I didn't hear you.
Is there a certain day or time that's good for you to meet twice a month?
Tuesdays and Thursday evenings are best for me.
Okay, so how about we do Tuesday, October 7th. Does that sound good? And we'll do...
That'll work.
We'll say 5:45.
Wait. The 7th, is the 7th a Monday or a Tuesday?
Let me double check.
I think that's a Monday. Can we do the 8th?
Yes, the 8th. Sorry. I apologize. Yes, the 8th will work. Will 5:45 work?
That will work.
Okay, and these sessions are an hour long. So in coming into your next session, I'm going to give you a little task. I would like you to just kind of document your pros and cons of having a relationship with your mother and your brother, and just any other notes that you feel like you might need to bring to the next session. Sound good?
That sounds good.
Do you have any other questions for me today?
How long are the sessions?
They're an hour.
Okay, yeah, that's it.
All right, thank you, Miss Ellen. Thank you for your time today, and I will see you on Tuesday.
All right, thank you.
Have a good night.